So now we're live. Hello, everyone. Apologies for the slight technical hitch there and the late start to this. Welcome again to an accuRx Saturday morning webinar, a Saturday morning special on the accuRx vaccine solution. We've been working round the clock here at accuRx to put together a product, which you're going to see a little bit more about in a second, working round the clock to help the primary care deliver the vaccine program through the enhanced service spec that has been put together very quickly over the last couple of weeks. So my name is Matthew Honeyman. I am the policy lead here at accuRx. I'm joined today also, and this is the order that you're going to hear from our colleagues in. I'm also joined by Jacob Haddad, our co-founder and CEO. Jen Rose, who's a product manager who's been leading on the vaccine product work over the last few weeks, and Tom Eilon, our VP of strategy and who leads on our commission and partnerships work. The schedule that we're going to run through today is we're going to do a little introduction to set the scene and about why we're doing this webinar so urgently. I think we gave you about less than 24 hours notice, so thank you so much for so many of you for joining us today. We're then going to run through a little bit about the product, the work that's been going into it over the last few weeks to build it, to test it, and respond to some of the feedback that we've been getting in terms of what the booking solution looks like. And then we're going to talk through the latest on central procurement, and most importantly after that, how you can make sure that you can get access to it locally in your area to help deliver the vaccine program. So just very quickly, let me talk about why now. We know that we've heard consistently from a lot of the practices who are involved or are thinking about being involved in the vaccine enhanced service, that software for booking, for delivery is one of the key factors that will make their decisions, make or break their decisions to take part at all. So this was one quote from someone that we heard from this week on Thursday, which really spurred us into action to, clarify the ways that you can get access to this today and share more information. So they were really hoping whether they know whether they can get access to this solution by yesterday lunchtime, Friday lunchtime. And that was going to make or break their decision about whether to sign up to their enhanced service, which we understand the deadline for you guys is on Monday. So we also know that some sites are going to start vaccinating in the week commencing Monday the 14th. So we wanted to share with all of the people who've been expressing an interest, who've been getting in touch with us. We're sorry we can't have had any conversations with everyone so far, so we wanted to use this webinar to share all the information that we have at the moment and give you clarity about the next steps in terms of getting access to this solution. So I think I'm just going to let Jacob jump in for a second there if there was anything that you had to add and to say hello to everyone. Before I do hand over to you, Jacob, I just should say people can start asking questions in the Q&A right now. We've got a team of accuRxers who are also kind of working behind the scenes to go through those questions and make sure that you've got answers to them or they're flagged to us on the panel. So we're going to have a Q&A at the end as well, so we can give you some clarity on things that aren't being answered through the slides. So yeah, we'll go to Jacob next, and then after that we'll hear from Jen. Hey, Jacob.
Thanks very much, Matt, for the intro. And yeah, thanks again for joining on a Saturday morning. We all know you've got a huge amount on. So let's jump straight in. I'll hand over to Jen to demo, and then I'll talk to you afterwards a bit more about how you can get started using us. Jen, over to you.
Great, thanks so much. Hi again, everyone. I'm Jen. I'm the product manager at accuRx, who's been leading on the build for the vaccinations booking product. So I'm going to share my screen and I'll take you through what it is we've been up to. So hopefully now you should see my screen. So the first thing I'm going to show you is how kind of a designated booking site would set up their first clinics or sessions. And then I'll walk you through kind of inviting people to those sessions. So first thing they need to do, so this practice, let's imagine that that's the designated booking site. If I click here into the vaccine sessions, you can see here a kind of setup page. So this is really where they're setting all of the booking slots that they want patients to book into for both their first and second appointments. So you can see here they can set their delivery site address. So this is what will be shown to the patients in the booking flow of where they are going to go to get their vaccinations. And then here the practice code. So this will be the people that are working with you within your PCN grouping or whatever grouping you're working with in terms of who can invite their patients to come and book into your sites. So I can add another site here, with their ODS code. One of the things we are working on as well is making that easier to search, because we know you might not have ODS codes to hand, so making sure that you're able to add practices quickly. And then you can see down here, this is kind of a table of the clinic times that you're setting up. So obviously there's some nice logic there around adding in a session and then adding another one 28 days afterwards. So we're going to make sure that this is nice and clear, and continuing to work on that based on kind of user feedback that we're getting from people as we're doing usability testing here. So you can see I've got a session set up for today in the afternoon. There's one tomorrow. And then what I can do here is go in and edit this one in terms of your start times and end times, how many patients you think you're going to get through per hour. We know for people this might kind of change as it goes on and you learn more about what a COVID vaccination clinic looks like. And then what you can do is, once you've got those kind of details there, you can set that live. So once a session is set live, that means patients are able to book into it. So I can set that one live. And then what I'll do as well is set one that's 28 days afterwards, so that they have their second session to book into. So patients will see those ones that have the two slot types there. Again, we're working on iterating this based on feedback and how people are thinking about getting those slots set up, because we know trying to understand what vaccine you're going to have in 4 weeks' time may seem a bit daunting because we don't know about delivery times yet. So we've made it as flexible as possible and changing it based on the information we have. What I can do then is go into what it looks like for an inviting practice. So in practice to come in and invite their patients. So this is another org. So I can upload my patients that I've pulled from EMIS System 1, my medical record systems, to be able to send those out invites. So if I click here on this invites, I can upload a CSV file. And you can see here that these people have got mobile numbers, so they will be sent SMS invites, and then we'll come back to Valerie Smith later in terms of how we get her booked in. So if I can continue, I can change the text that's in the invite text, so you might want to add more information here. But by default, it kind of gives you some default text there if you want to send it out quickly, and I can get that sent. So you can see here that that patient list was 3 people I uploaded. There's 1 person here to manually book, which I'll come back to. And then there's 2 people that are waiting a reply. So what I can do now is go into my messages, and you'll see here that I've had this text come through to say I've been invited to book. I can click on that link. And what I'll do is actually show you what this looks like in mobile view. So if someone wanted to come in and book here, they can click continue to booking. Yeah, you can see here that location that I talked about earlier, and continue. The patient has to put in their date of birth, and this is because we're sending out unique links. So they can't share that link with anyone else. It's that person that you've uploaded. That's the only person that can book in for these booking slots. So you can see how I can now see kind of available appointment times that I can book into for today and for tomorrow as well. So let's say I do want to go tomorrow. I can click 8 a.m. tomorrow and continue. And then you can see here I've got that corresponding slot for my second vaccination. So a patient can book in both at once, which makes it a lot easier for them versus trying to figure out after they've had their first one when their second one should be. And continue. And then I can review those slot times. I can go back and edit those if I need to, if actually I'd rather have a later time or a different day even, and confirm and accept. Then you can see my vaccinations have successfully been booked. That patient is now booked in. If I go back, so if I click into here, you can see that I am now booked. We're awaiting Mike's response, but Valerie here didn't have a mobile number, so she didn't have a way to get an SMS. But what I can do as a member of the practice is click on the booking thing here, and that will open up her link. So I'm able to maybe have Valerie over the phone or get her booked in and send out the confirmation of when to get her booked in for. So even if people don't have mobile numbers, you can still get them booked in. What I'll do now, the last thing I just wanted to show you was the kind of on the day view. So this is kind of where the booking flow comes up to. And this page gives you an on the day view of everyone who's booked in. So you can see times, see the NHS numbers and the details of the people and what times they're booked in for. So that's all I wanted to show you in terms of what we've built so far. I did want to have a quick note as well around kind of the updates that we've been making. So obviously, as you've kind of heard from every communication, everything's changing really fast. We're getting new information all of the time. And I just wanted to highlight that the way in which we've built this is in a way in which we can respond to those changes really quickly. So one example there is kind of the Green Book gave us updated guidance around the COVID vaccines. An example of both of them that are on the table at the moment being able to be delivered 28 days apart versus 121 and 128 days to make it easier for logistics. So we've been able to update the product to say, cool, logic is both of those vaccines 28 days apart. And so that's just one example, but throughout the product, that's how we've built everything so that as new information comes, we can change what we're doing specifically. So it's as easy as possible for you to get your patients booked in kind of with the right processes. So I'm going to stop sharing my screen and hand back over to you, Matt.
Amazing. Thank you so much for running us through that, Jen. It's really exciting to see the work that's, the product of all the work that's been done over the last few weeks and in collaboration with practices at the frontline and others. So I think next we're going to hear from you, Jacob. I will just work on sharing the slides again. And I had some feedback that I'm going to try and make them a bit bigger while you're talking. But I think I'm just going to hand over to you and let you kick off if that's okay.
Absolutely. Thanks a lot, Matt. And thanks, Jen, for that demo. So the question that we're getting a lot is, how can you use us? So if we can just jump forward a couple of slides, please, Matt. How can you use us? Obviously, as Matt mentioned, sites have been starting to be told they need to be ready to vaccinate from the week commencing the 14th. So PCNs have been told, you've probably heard in the NHS England webinars, that they're responsible for their own invite and booking arrangements. And many practices have told us, PCNs, practices, CCGs, that their existing appointment books don't meet their needs, whether that's patients being able to self-book, whether that's booking across sites within a PCN, whether that's making sure the 28-day booking happens, or sending booking reminders, or even just being able to book patients in very, very fast so that you can get through large volumes of patients. And we understand that because obviously those systems haven't been built for a program like this. And that's why we built something specifically designed for vaccinations. So NHS England have just told us there will be a national procurement framework that will be announced this coming week. And this will be great. So we're hoping this will work like the video consultation framework back in March, which meant that practices can just go and use us. So PCNs can just go and use us if they would prefer to, or other solutions that are on that framework if they'd prefer to. For running invitation and booking of the vaccine program. So hopefully that happens. We know, however, that given that practices need to start vaccinating in under 10 days' time, you need confidence in being able to use a working solution immediately, and not just sort of from the 14th, but being able to get your staff set up, familiarised with the system, book in patients in advance of that date. And even, one thing we're hearing from sites is we need to know if we need to hire extra receptionists and phone lines, if we need to book in patients over the phone, and that's obviously something we're trying to avoid. So our aim today is to really give you confidence that you will be able to use us. So we're hoping this national procurement framework comes through, and we'll hear more from NHS England this week. If that is not ready by Wednesday morning, then we'll start to let you procure directly. If national procurement framework does then become available, you'll be able to transition to that. And Tom will talk a bit more about how that will work. So yeah, the key message is you will be able to use us, hopefully through the national route, but we have got a backup plan if that isn't ready in time for the first sites to ready to start vaccinating. In terms of recording vaccinations, so you probably remember in our last webinar, we showed you some of these screens. So on the actual day when a patient has arrived, make it really, really fast, really easy and intuitive to record vaccinations, to see patients' vaccination history, to see allergies from their medical record, and to send safety netting advice. And so that is also part of our solution. And so, yeah, I've shown some screenshots here of both recording vaccination, also recording allergies or adverse reactions. Matt, can you jump to the next slide, please? Currently, only Sonar and Pinnacle are approved for recording vaccinations, and that's something where waiting for NHS Digital Assurance to be able to be on that list, so you can use us instead. We got the specification through for that yesterday evening, so we're hoping for assurance with NHS Digital as soon as possible, and then once that's come through, you will also be able to use us. So the typical questions that come up are, will the data go back into the medical record? Will it go into NIMS? Will it go into the BSA payment system so that PCN is getting paid for vaccines? And will it meet the MHRA requirements for capturing vaccine information and also adverse reaction information? So we've built against that specification. We meet that specification. As I say, we're just waiting for assurance. The demo that Jen showed you went up to the booking point. So you can use that up to getting patients, a steady flow of patients on the day, and then go and record vaccines in Sonar and Pinnacle. And if you're starting to vaccinate from the 14th of December, that is what we suggest you do, because that is what is working and available to you now. As soon as we've got assurance, that will be part of our same solution. And the real benefits here, aside from providing a more intuitive flow and the clinical safety of having allergies and immunization history and things like that, is by having it in an end-to-end flow, you won't need to go and look the patient up on the spine and check their identity. You'll be able to, from the booked list, just go straight into vaccination recording for that patient. It also means we can provide both you as the provider and your commissioner and everyone coordinating the vaccine, but also nationally, a much more comprehensive data set of uptake. So for every patient invited, for every practice, how many have been invited, how many have been booked, how many have had their first dose, how many have had their second dose. So we can provide that sort of continuous data set by aggregating patient level information, which is going to be really important for planning and understanding, for example, where in the country does there need to be more public health messaging and things like that. So main message here is we do have a solution for recording vaccinations. We are waiting for assurance on that from NHS Digital, but we do meet the specification. And once that is then available, you will be able to use us. Do you want to jump to the next slide? So yeah, these are some of the specifications that have come through. And as I mentioned, we're fully complying with that. So I'm going to hand over to Tom now, our VP of Strategy, who's going to talk through, as I said, obviously, hopefully we can be procured through that national framework. But if that is not ready for the first sites, what you'll be able to do from this week to get yourselves up and running. Tom, over to you.
Hi, everyone. Good morning. If we flick to the next slide, we know many of you are in a position where you need to make decisions now. We need to make a route available for you. We have many uncertainties, so we need to plan for every eventuality. We've engaged with NHS England to hopefully provide a national framework for you to get this software. Our preference, and we think the simplest route, is for this to work like the video framework, where you could pick up the software, use it, and the funding would happen centrally. But we don't know exactly what form this will take. It may take a form where organizations need to come directly to make a procurement. So we have planned for that case, and I'll talk you through what that can look like. If it works that local organizations need to make the procurement directly, we want to make that available to PCNs, CCGs, SCPs, ICS, any of those types of organizations. And of course, if one organization does make a procurement, but is then superseded by a larger organization, like a PCN following by a CCG making a procurement, the contract will be wrapped up into the larger procurement. Of course, we will not allow any sort of double payment to happen, even where procurement's happening at multiple levels. We'll manage that complexity. So if we move on, how much will it cost? So the cost for the software license fee is set at 49 pence per patient population per year. That number excludes SMS costs and excludes VAT, which you'll be able to reclaim. We estimated SMS costs at 6 pence per patient population. There's a lot of variables in that, including the proportion that you'll need to vaccinate, but that's our best guess at this point. And the contract term we anticipate to be a 1-year term with a 90-day break clause, which you can use at any point. So, we all hope this will be over soon. And if it is the case that this software is no longer useful for you after 6 months, then you can use that provision and pay less because you won't need the full year of the license. Jacob mentioned that the product we're offering is available for the booking functionality, the call recall, as well as the point of care solution, the vaccine recording. We're not assured yet at the point of care solution, the vaccine recording, so we will reduce the license fee by 50% for every month, and we anticipate that only to be 1 month where we're not assured. So if you do progress to make the procurement, then we'd anticipate the first month being at half the cost and then back to the full price on the month following our assurance. If we flick to the next slide, please, thanks. People often ask, showing the price, is there a discount available? Yes, we do want to make discounts available where it makes sense. So if you do make a procurement, we will discount any purchase of accuRx Plus bought before April next year. And if you represent a large population, over 1 million patients, we'll offer 10% off the license fee, or 2.5 million patient population, 20% off the license fee. If we go to the next slide. How will it be charged? So we plan to charge monthly for license fee in advance, and then monthly for SMS costs in arrears via direct debit. The reason we're going to plan to charge for the license fee monthly in advance is to cover our cost of the SMS, which we'll cover for you during the month. We anticipate this, hopefully if there's wide national adoption, could be quite large. So that is the reason for us charging for a bit in advance, to make sure that we have the cash flow to manage that seamlessly for you. How will it be contracted? So we very much hope there's a clear, simple central framework for procurement. If that's not available by the morning of Wednesday, the 9th of December, we will enable you to contract directly with us, just a simple via electronic signature through a contract. If we flick to the next slide, please. And what you should do now, waiting for Wednesday, if you do plan to progress, please do get in contact with us. We're available at partnerships@accuRx.com. We can talk through the full process and get everything ready for that Wednesday morning for every eventuality. So if you do feel that you want to make the decision immediately, that's the thing to do. Just write to us exactly what you want to, how you want to progress at partnerships@accuRx.com. That's all from me. Back to Matt.
Brilliant. Thank you, Tom. So I think, I would just like to reiterate why we're doing this now and why we're asking people to get in touch with partnerships ahead of Wednesday. It is to go back to that very first slide. We had been hearing about the kind of urgency that you guys need this information to make this decision. So we just wanted to set out all of the routes available. We're still waiting for some parts, some information, and all of this is being done and led under great uncertainty. So we just wanted to lay that out as much for you as possible. So we're going to go on to some of the Q&A to try and resolve to answer some of the questions that have been raised throughout the session. I've just stopped sharing so that I can actually see the Q&A, and I think there's a couple of questions that we should get kicked off with. So there's one which is a kind of question about the boundary between the vaccine product, for which we don't have a product name at the moment, so we're just calling it vaccine product, and normal accuRx. Would that be something that you and Tom can handle? So Jacob and Tom, come to you, Jacob, and Tom can come in after.
Yep. So I'm just trying to find the question you're referring to.
So it's
read it out?
I can read it out verbatim. So is this available as part of normal accuRx, or is it an add-on?
So it is an add-on, so it's not part of accuRx Plus. Obviously, as Tom mentioned, there is a discount on accuRx Plus if you purchase this and then purchase accuRx Plus before April. But it is a new piece of functionality and it's an add-on.
Okay. Cool. And so yeah, that's really clear on that one. So there's also a question here about whether so this one's for Jen, I think, in terms of product and the product flow. So can the patient decline the offer via their mobile phone? If so, will this message come back to the practice?
Yeah, that's definitely something we'll be working on like now. So the kind of things we want to add in are, well, one thing that we already have is follow-up reminders. So we'll be offering the opportunity for a patient to dissent and say no, and then that will block you from sending them future invites. I also saw a couple of questions around amending, which is also something we're working on now, which will be there when this is ready for procurement. So a patient being able to cancel their own appointments, or more likely being able to amend. So if they can't make the appointment, they can amend that and make sure that they still turn up rather than DNA.
Okay, great. So there was a question here about pricing. Sorry to jump around, but these are the ones that are kind of like at the top of our list. So this one I think I'll throw to you, Tom. So it's a question about whether it's per eligible vaccine patient or per PCN registered patient.
It's the latter, so it's put for the full population list is how it will be calculated.
Great, really clear, thank you. So a question here about non-registered patients. So whether, for example, that shared in this question, if care home staff are in cohort 1, to whom we can still invite and offer COVID jabs, what happens if they're being offered these jabs, as this question is saying? Can they come and can they be invited through our solution, even if they're not locally registered within that GP, one of the practices within the primary care network grouping? Jen, that might be one for you, I think, or Jacob, one of you.
I can take it. So you can invite any patients so long as you have their name, NHS number, date of birth, and mobile number. Obviously, you may not have that for care home staff. So you might need to book them in another way, or we can look at other ways of letting you invite patients in that scenario. We are also putting in this week a way to sort of ad hoc add patients, and similarly on the actual vaccination recording end, you can go straight from the list, but for you to identify an individual. So if you did have a care home member of staff attend a session and they weren't booked in, you could manually add them in, just like you would in Sonar Pedicle. So yeah, there will be support for that at the point we go live.
Brilliant, thank you. So a question about the kind of configuration of that distinction that you were talking about between the two different vaccines that are likely to be available to primary care in the near future. So whether it's possible to configure the 21-day recall exceptionally if a practice was looking to do that.
Yeah, definitely. So like I said, this is kind of like we're going off of the information we've got up to that day. So I think the main learning we've had is just to be really flexible with this. So yeah, we'll be looking into how we can offer that. So at the moment, we do have the AstraZeneca being 21. I think I've got that right. And the other one, the Pfizer one, being 28. So we'll, the other way around, other way around, the right way round, I assure you. So we can make sure that that's still flexible to do. The other thing we might do is just make you be able to set up a clinic and say whether it's 21 or 28, to just make it really clear. So yeah, we'll be doing that.
Cool. I think there's some important bits of feedback as well here, just in terms of the time pressure. So the next question I was going to feed in is about whether it's possible to have a solution in place by Wednesday. So we will need staff to start recall by Wednesday, we think, and so a solution would be required by then. Our initial group is over 80, so we also need time to call patients. So I think Jacob on the availability, and then Jen, I'll come to you about how to manage patients who may need to be called.
So the good thing is, if you're already using accuRx, which 98% of practices are, as soon as either through the national framework, which we're hoping is ready by then, you're able to just pick us and start using us. Or if you do need to procure directly, because the national framework isn't ready in time, as soon as we've just had a DocuSign, so an electronic signature on the contract, our support team flick on that feature flag. There's support articles going in early next week in terms of exactly how to use it and videos, and then you'll be able to put in the sessions, which Jen showed you is sort of very quick to do, and then start inviting and start booking patients in. So because you're already using accuRx, the actual implementation is very, very fast. And we've also designed it. This is something that people have to pick up incredibly quickly. There's going to be a lot of staff sites are telling us who haven't worked in primary care before. So we've really designed it in a way that it's just as intuitive and straightforward as possible for new staff to pick up.
So Jen, would you be able to talk about the people who may need manually following up either through phone or other means?
Yeah, definitely. So what we'll do is pull through the number that they have on their record, and that could be a landline number if they don't have a mobile number. So for those people that don't have mobile numbers, and as someone asked in the chat as well, if it fails, so say they've updated their mobile number and that's not valid anymore, those people go into like a to manually book section. Again, we've tried to make it as quick as possible to reduce the time that you have to spend booking people in. So you can click on that link, verify the date of birth with the patient if you have them over the phone, or you would have their record to verify, and go through that flow and book through the available dates for them. So anyone without a mobile number, you can still get booked in. Obviously, they don't get the SMS invites and they won't get confirmation texts or reminders, but they can still be booked in the same way for their 2 appointments.
Brilliant, thank you. So what about the question of how accuRx sits with GP Connect? I understand that there's been some information about how to link up appointments through that. Jacob, would you be able to handle that in the first instance? I think you're on mute.
Sorry, so the immediate answer is our appointment system is separate from GP Connect. The main reason why is when we spoke to delivery sites, to practices at how to do this, and also looked at sort of comparable like queue management, operations management in other sectors and how it's done. What we heard is really needed is not, I need patients to arrive at these specific times, but I need a steady flow of patients throughout the session. I don't want too many arriving, and then I've got a problem with social distancing, or I've got 85-year-olds waiting outside in the cold, and I don't want too few arriving because then I've got staff who don't have anyone to vaccinate, and we're really trying to maximize capacity and vaccinate the population as fast as possible. So we've optimized the entire system for having a steady flow of patients throughout the session. And what that means, for example, when Jen showed you, setting capacity per hour for patients, which we then divide amongst 10-minute slots. If you find that actually you're getting a 5% DNA rate, you can factor that 5% into your capacity per hour and overbook slightly. If you find that as you go through cohorts and you get to younger patients who are more mobile and who are able to do the consent process with faster, you can up your capacity. And so we've really tried to give you complete flexibility to be able to flex that as you learn more about your sessions and more about sort of the best way to deliver that. So that's why we're not hooking in with that. And there's sort of a few other limitations, but really this whole program, this whole solution is designed specifically for vaccinations, not for sort of general, well, specifically for recall, I should say, not for sort of like general appointments.
Okay, great. So there's a few comments about pricing levels and in relation to the value of the product that's being offered. I wonder if Jacob and then Tom could kind of comment on that, as I think there are quite a few around. So it's but I think that's the kind of like the general theme is about whether we think this is worth the price, and also about the kind of why the reasoning behind the discounts that we're applying to bigger population sizes and
so we originally had a pricing model which was per patient vaccinated both doses, so the same way that PCNs are being paid. Obviously the price point was higher because uptake is going to be lower than the whole population, well, the whole eligible population, and not the whole population is eligible. What we found with conversations with CCGs and STPs is that was too complex, and they needed a fixed figure that is, this is how much this is going to cost me, without sort of the variables of uptake, and also sort of that higher figure was just being multiplied across population anyway. So to simplify it, we reduced that and just said, right, this is a patient population. We probably won't be the cheapest solution. Like there will be non-healthcare booking solutions out there that will be cheaper to go and use. When we talk to ICSs and STPs, CCGs, PCNs about this, the ROI that they're very, very focused on in particular is so phone lines, staff on the phones for booking. So having to book 2 doses manually on the phones, and sort of all of the costs that come with that, both staff obviously, but also extra phone lines, and in some cases hiring those staff and training those up to increase capacity, because obviously practices still need to run their receptions normally for all other patient needs. The others have been just the ease of setup, and particularly like sharing across sites and making it very, very faster, even if you are booking in a patient over the phone because they couldn't book, making it just a lot faster to do that. And then on the day, so we showed you the recording vaccination flow, making that take half as long as it would with Sonar Pinnacle, essentially. So by having the demographics pulling through, by having a more intuitive user interface. Now, obviously, until we've got the NHS Digital Assurance, you can't use that part, and that's why, as Tom mentioned, we're applying the 50% discount until that is in there. In terms of discounting, we've applied that because we're really constrained by how many conversations with individual PCNs we can have, and so we're trying to incentivize areas to group together, and for whole ICSs, STPs to get a solution across the area, and that obviously means we can also deploy a lot faster and more easily.
Yeah, I completely agree with everything you just said, Jacob. I think the only other thing to bear in mind is I'd like these organisations to see it as a monthly running cost. If this is no longer useful for them in, let's say, 6 months, 6 months, then very happy to terminate the agreement early, and therefore would only end up costing a fraction of the annual license fee. That's the only other thing to add.
So I want to ask a follow-up question. I think it relates to some things that have been coming through in the Q&A. There, apologies, I have not been able to get through 102 questions to check every single one, but thank you. Do keep them coming in. We're trying to get through as much as possible. It's whether this can be used for other vaccination programs and other things that either are going on in parallel or maybe going on in the future. What's our position on that availability, Jacob?
Yes, we're going to be expanding it for all recall. We are, completely focused on having the most reliable and efficient solution for COVID vaccination for when practices start vaccinating. So as Jen mentioned, that example of, currently, we let the practice cancel and rebook a patient. Working on this week, patients being able to cancel and rebook, and just constantly getting in these improvements that are to make COVID vaccination as efficient as possible, particularly because a lot of the constraints around this that flu doesn't have. So booking across sites, the 28-day vaccination, and the patient information we're going to send up front, and the safety netting after. As soon as we're at that point where we feel, practices are, have got, something that is really meeting their needs, and as people hopefully know, that doesn't stop with us. We keep improving. Yes, we will be expanding this for other recall. I imagine the main thing on people's minds is 50 to 64-year-old flu vaccinations, which we do want to support, but we have got a laser focus on COVID vaccinations, dose 1, dose 2, and vaccinating the population as efficiently and safely as possible.
Brilliant, thank you. So when I said that we weren't going to get through every question, we won't be covering every single one live, but I think we are trying to cover as many of the themes as possible. So don't want to discourage people submitting there. There's one theme is about the kind of flow between our products and other solutions that might be used in the kind of organization of the vaccine program and then running the designated sites on the day. So I'm going to throw those to you, Jen. So one is about the kind of entry to the kind of like starting point of where our system comes into the flow. Like how do people, would you just be able to kind of run through the kind of upload again and where that's being pulled from? And one specific question came back is about whether it's saved back into the record that a person has received an invite.
Yeah, absolutely. So the way in which we've built it, as I think Jacob mentioned earlier, is you just need their kind of a unique identifier. We've got NHS number for now, as well as kind of date of birth, patient details. So that is kind of, doesn't matter where you're uploading that from. It could be EMIS, it could be System 1, it could be Vision, it could be Microtest, it could, whatever you're using, you can upload patients into to get them booked in. So they're kind of, that link doesn't matter at that point. What we've also, there's a couple of comments in there around like what will be written back into the record. So obviously we do already have really great integrations with EMIS and System 1. So that's going to be really easy for anyone using EMIS and System 1 to get that kind of coded and written back into the record, which will help you kind of searching for your next group of patients. So you can filter out anyone who's already had an invite based on SNOMED codes going back in. What will be a little bit tricky is where we don't have such strong integrations. What we will do in that instance is provide you with CSVs so that you could batch upload and batch code those back into the records. So understand that that's not as great an experience, but we will at least offer you the functionality to be able to do that and get that coded back into the record.
That's really helpful. And then in terms of on the day, what practices people running the designated sites do to pull information out of our booking solution as it is at the moment? I know we're looking for the end-to-end flow.
Yeah,
eventually, but for those starting on the December the 14th.
Yeah, good question. So for the kind of booking product side of the delivery day, we'll also offer a CSV download with all of that information in of people who have booked. Equally, if you did have that window open, you'd be able to copy and paste over. So say, for example, copy and paste over the NHS number to search for that patient in another system. That would be quite quick and easy to do. But yeah, we'll also offer CSV downloads for that.
Great. So a few questions have come in about the consent process and how our solution supports this at the moment. Jen, are you able to kind of kick off on that one and our understanding of what we can do to support practices?
Yeah,
that?
Absolutely. So this is another area where we've kind of been waiting for more information to make sure what we build completely covers that. We will be building that into the flow ready for a go live date so that you could capture information. Those of you who are accuRx users and know kind of Florey questionnaires will do something similar to that so that you can capture that consent beforehand. What we're still trying to figure out, and Matt, please do jump in if you think we know this, is around like what we need to do beforehand versus what you need to do on the day. So we want to make sure we're covering both those bases there of kind of streamlining the process for you beforehand so you can capture that information, as well as making it easier if we did have the delivery day side for capturing consent on the day as well. So yeah, kind of a very vague answer, but more like, yes, we're on it and we're going to be offering something to help with that.
Great. That's really helpful, really clear. I think part of the thing that's so exciting for this. So I think the reason you asked me to come in here, Jen, was we'd been doing some thinking about how software can help this this whole vaccination process. Like, it's a massive communications challenge. Our product and our wider platform is a communications platform for primary care, and so while we've been we've worked really hard to get a minimum viable product and make sure that the absolute a high quality product is available for go live date. It's like, the exciting thing is the iterations and the additional value that can be brought afterwards. This program's everyone is working as quickly as possible, but there's a huge task and a huge population to go through. So it's really exciting how some of the features that people are asking for can be built on top of that in the future. So I'm going to ask a few more questions that have been coming in from the Q&A. Please feel free, like other panelists, if you're reading, if there's things that you want to jump in on as well that I'm not kind of flagging, you can hit answer live. Jacob, you just raised your hand as if you're about to come in, so I'm going to let you take some of them. Yes,
this question of, has this offering had NHS Digital Approval for use, that we've had in? I mentioned obviously the recording vaccinations part, where we are waiting on assurance for that. We got the spec through last night, and we're pushing to have that as soon as possible, so we can get you that functionality. In terms of the booking, no booking solution has had no COVID vaccination booking solution has had NHS Digital Approval for use. Practices were told, this is up to them, and we've been told, previously that NHS Digital are happy for practices to use us. Last night, with the latest spec, we're told there is plans for a national procurement framework, and so we will go on that. As soon as we can get an assurance session booked in. Just messaging with NHS Digital, and it's looking like that might happen Tuesday. But regardless, this will be available from Wednesday. So no booking solution for COVID vaccination is currently assured against that capability. So hopefully that answers that question. Obviously, we'll keep everyone updated as soon as we know more from NHS Digital in England. Brilliant, thank you. If either of you two, if Tom or Jen would like to come in on any questions, just feel free, just raise your hand. I'm watching you on the video. So there's a question here about slot type being linked to the vaccine type and whether that's been shown to patients. And I guess that kind of links to some of that, the informed consent process that we're still waiting for a little bit more information on. But that's a question for Jen about the linkage within the solution that the practice uses and then what the patient sees at the moment.
Yeah, so sorry, could you just reframe the question for me?
Sorry. So is the slot type linked to the vaccine type? So say the Pfizer or the AstraZeneca vaccine, and what is shown to the patients about the slot and the vaccine they're receiving?
Sure, got it. Yeah, so I'll start with the patient. So as far as the patient is concerned, they get told to book in their 2 jabs. The way we have it at the moment is, as I said earlier, kind of one is configured to be 21 days after, one is configured to be 28 days after. We're ready to change that if guidance changes, but to be honest, it's been really helpful to get the feedback in the chat as well that you do want those separate times of 21 and 28. So we'll keep that as it is for now, so you can configure that on a per vaccine basis. At the moment, the patient doesn't know what kind of vaccine that they're going to get, and they don't get displayed that vaccine information. They just get told that they need to have these 2 jabs kind of at the specified time apart. And then from a clinician point of view, from the practice point of view, they can go in and set up those sites specifically to do with the vaccines. So we're waiting to find out more information in terms of how far in advance you're going to know what vaccine you're going to get. To make sure that information that you're putting in the setup page is correct, and you're going to have that information. But as it stands at the moment, you put in the vaccine on that kind of setup day for the clinic. So you're going to be delivering AstraZeneca. Great. And then that dictates when the patients are booking in their first and second jabs. So hope that clears that up, but happy to take any more questions on that.
Brilliant. Thanks very much, Jen. So I had a question, but it's jumped out of my eye line. So I think it was mainly around some feedback around. I think it was about the pricing, and I think it was asked just before you covered this, Tom. But it's worth reiterating. So and it includes a bit of feedback. So if practices sign up, will it be a one-off payment or monthly, as practices don't get paid, likely not to get paid any vaccine income for around 8 weeks after they start?
Yeah, great. So the license fee will be paid monthly in advance. And we will use probably all of that to cover the SMS costs over the month. And we will put through the SMS costs back to the organisation monthly in arrears. Those SMS costs are the raw SMS costs that we get charged by the providers. We don't add any margin onto that. That's just billed straight through, make it easy to manage.
Brilliant, thank you very much. Questions come in about the NHS the approval process. So if the spec that was, this is a question specifically for Jacob. So we had the spec last night, or you said we had the spec last night. How close are you to being confident that you can meet that spec essentially, and then submitting for approval?
Yep. So we already, anything around booking, we already meet. Around recording vaccination, very confident. It's just a case of when can we get that assurance in. So we're waiting for a date on that. And that's why we're saying, until that's there, for recording, you do plan to use Pinnacle or Sonar, hoping definitely before Christmas that practices will be able to use us. Certainly before vaccination ramps up in January, and you need sort of to save that extra few minutes per patient. Until we have that assurance date from NHS Digital, it's honestly just quite hard to say. But booking sort of meet any requirements, and that's very ready to go, as we mentioned.
Brilliant, great. A question that I had marked for answer that came in, I think, before the webinar, which or after, it says it's asked here at 12 minutes past 4 p.m, which is the question has either got a time machine or it's just a feature of Zoom you can ask at any time of day. But can we restrict sessions to individual ODS codes? So I think this is a really important point that might have been covered in your demo, but worth repeating, Jen, about how we're making sure that the practices in the groupings are working together. Yeah,
absolutely. So on the hopefully it was clear in the demo, but on that setup page, you basically, as the designated coordinating site, you can invite in practices to be able to book into your slots. So kind of works as the central site is setting up those clinics for people to book into, and they can invite other practices via ODS codes to book their patients in. So any one of those kind of practices within that network will then see the second page I showed you with the CSV upload to invite their patients in to be able to book into those appointment slots. So that's kind of based on, PCN groupings. Obviously, if you're a single practice PCN or a single practice site, you could do this on your own. You don't need to add in other practices. And I think, as Jacob mentioned earlier, we're also going to be working on you being able to book in unregistered patients. So patients that aren't registered with different GP practices, and that kind of ad hoc booking that we know is going to be really important. We'll make sure that you can do that without having to go through a really clunky process to get those people booked in as well.
One thing to add as well is I think what the question might be getting at, although I might be completely misunderstanding it, is I've had a few conversations with PCNs this week and the week before who've said we're actually going to divide up the days, and practice A will vaccinate their own patients on Monday, practice B will vaccinate their own patients on Tuesday, and practice C on Wednesday from a single site. If that's the route you wanted to go down, the way you would need to do that is each of those practices would need to set up a session and then just not invite the others. So we have that full flexibility if that's something you were planning to do. It's not something we've heard a lot of, but have certainly heard a couple of PCNs looking to work like that. And yeah, we do support that.
Cool. I just wanted to ask Tom to run through in response to a few questions that I think are coming in about the discounting arrangements and a reminder about those in relation to the booking solution, the delivery solution. Tom, do you want to take those?
Sure. So the product is planned to be the booking solution and the point of vaccination delivery solution. Before we get assurance for the point of vaccination vaccine recording solution, there'll be a reduction of the fee of 50%. So the fee for the whole thing's 49p per patient population per year. Before we're assured, we'll only charge half of that on a running monthly basis. There are further discounts available. So any organisation that does make a procurement before the new year, we will give 10% off on an accuRx Plus purchase before April 2021. And also, if you're an organisation representing a large group of patients, over 1 million patients, there'll be a 10% reduction or discount on the vaccination software license fee. And if you represent a population of more than 2.5 million patients, then there'll be a 20% reduction on the license fee.
Brilliant, thank you, Tom. That's really clear. I think we're coming up on time, and we want to keep you over the hour, so we've got a couple of minutes left. So thank you for all the feedback that's been coming in. We're definitely taking it away and using it to improve the product, to understand people's needs in greater depth. I think, we're not going to be able to get to some of the questions, but we are going to hope to, I think, publish a little bit more information in written form in the next week, because we know that is also helpful. So you'll also be able to share this webinar link, and we'll try to summarize some kind of useful times in it in the interim, but we'll publish a bit more written information in the next week as things are coming through. Guys, in the next 2 minutes, are there any other questions or any other things that you would like to address that have been coming through, or other themes? I think we've covered a lot of the themes that have been coming through.
I've just seen one that comes in again around the vaccination dates of the 2 different types of the vaccines that I just wanted to cover. Second vaccination date will be affected by supply of vaccine. Therefore, it may be 24 days or something and may change at the last minute. Is there that flexibility? So I just wanted to cover that one with yes. We understand that there may be kind of last minute changes. And again, that's how we've tried to build that whole flow of actually you need to set up a new session, and working on that availability for you to kind of unpublish a clinic. So say, for example, you have people, even if you've got people booked in and then you find out that you don't have the vaccine in time to vaccinate them, you can send out kind of cancellation and get people to rebook in for a new date. Equally, we're built, the kind of logic is that, yes, it will show you the kind of 21 days after, but actually show you some flexibility there around 3 days after that, 4 days after that. So we're working in that flexibility is already there, and we'll work on kind of iterating that based on the kind of real live data as we get it of how people need those to be set up.
Great, that's really clear. Jacob, any last word from you?
No, I don't. Thanks very much, everyone, for joining on a Saturday morning when we know you're all really busy. And yeah, we'll keep you posted. So do keep an eye on our Facebook user group and our Twitter. And yeah, do also keep the feedback coming. As always, we will keep improving things.
Brilliant, thank you. So you've done my job for me in terms of sharing how people can stay in touch. We just want to say thank you again for joining us, and goodbye.